Well, welcome everyone. My name is Bethany Peebles. I'm the Executive Director of the Consultation Department at Art Optical, and I want to thank you all for being here this evening. We're going to learn about MOONLENS and the KATTCloud Platform and how those are going to work really well together, very synergistically, to create an efficient myopia management practice. And here this evening to tell us about the KATTCloud program is Randy Kojima. Randy is the Clinical Research and Development Director for Precision Technology based in Vancouver, Canada. He also serves as research scientist and clinical instructor at the Pacific University College of Optometry in Forest Grove, Oregon. Additionally, he is a clinical advisor to Medmont Instruments in Melbourne, Australia. Randy has published numerous articles and submitted posters on various contact lens related topics, as well as been a contributing author to a number of textbook chapters. Randy also lectures globally and enjoys sharing insights, methods, and research with eye care colleagues from around the world. Lastly, Randy is a fellow of the American Academy of Optometry, the British Contact Lens Association, the Scleral Lens Education Society, and the International Academy of Orthokeratology. And with that, I'm going to go ahead and hand this over to you, Randy.
Great. Thanks, Bethany. And thanks to you and to Art Optical for giving me an opportunity to speak a little bit about the MOONLENS and the KATTCloud platform. As some of you on the broadcast may know, this is the second webinar that was dedicated to both the MOONLENS design. This one is more focused on how the MOONLENS is built out of a platform called the KATTCloud. It's basically the software that helps you to fit and problem solve the MOONLENS through the process of ortho-k. So let's begin. Now, in the last webinar, if you were on that broadcast, we talked about the many ways you can customize the MOONLENS, the base curve, the tear layer depth, the optic zone size, the lens diameter, the sagittal depth, the alignment zone shape, the toricity, the edge lift. Basically, you can completely customize this lens to create a eye and patient and age and RX specific lens for each individual eye. So there's a high degree of customization. And how would you do that? Well, you have to have topography. That's the starting point. Topography gives us the thousands and thousands of data points that we can use to build the right shape. Then along with the RX and the patient age, then the software can use that data to best design a lens specific for that eye. Now, it's the KATTCloud platform that's kind of the magic behind the MOONLENS, where it's going to take your topography, you're going to upload it to the cloud, or the art team will upload it to the cloud, and then the software will do all its work to design the lens, basically taking all the pressure off you to create the initial lenses that you will dispense to the patient. So this platform is very important to the whole process because it basically does all the heavy lifting, all the behind the scenes work for us. Now, topography we're really, really critical of, and Bethany and her team in the consultation department will tell you how important baseline topography is. It either gets us off in the right direction and we have a good chance of high first fit success, or it gets us off in the wrong direction and our initial lens doesn't fit the way we want it to or perform exactly as we desire it to. So topography becomes super important. Never take just one map. Always take multiple maps. And if they're reproducible, if you look at the 4 or 6 or 8 or however many you take on each eye, if they look reproducible, the same, then that gives you a degree of confidence that you have accurate topography. If they all look different, then the topographer is struggling to figure out what the eye shape is. So that's a sign that we need to change something in our capture. Do we need to steady up the patient? Is the patient moving too much? Is there too much blinking? Is the fluid layer moving excessively? Is there a problem with the instrument? Those are some of the things you're looking at. If you have the ability to do a composite topography, if you have a MedMont, that would be the preferable way to begin. But multiple maps, that's the key to determining if you're going to have an accurate starting point. Now, once you've got your best right and your best left topographies, then you're ready to upload it to the site. So you're going to use something called the Cloud Link. And this is used for users that have a linked topographer to the KATTCloud, meaning your topographer is an approved and authorized instrument to upload data to the KATTCloud. And there are specific instruments that do that: the MedMont, the Oculus, the Pentacam, the Keratron, and the CSO. If your topographer isn't listed, it may be coming. You can talk to the art team about it. If your topographer does not link to the KATTCloud, that's okay. You can still enter in the data and calculate lenses. This webinar is very specific to users who have a linked topographer, so that you understand how the process works of uploading your topography and the automation that's really involved. So once you click on that cloud link, which is embedded into your topographer software, it's just going to take those digital files, import them in, pull the data that it needs to build the lens, and calculate your final moon lenses. So and this is a case where we've uploaded a pair of topographies. The RX has been included with the map, the date of birth, the visible iris diameter, everything included with the topographies. So I don't actually have to enter anything in to the KATTCloud. It's all kind of taken off of your uploaded topography. So it's really quite convenient that way. Now, let's look at the right eye calculation. And what you can see is here we have our RX, our therapy target, the imported visible iris diameter, but I want to bring your attention over to this side. You can see this patient age is 8, so that would indicate that we want a myopia management type optic zone. So you'll notice a 5.5 millimeter optic zone has been selected, something specific to this patient's age. You notice that the sagittal differential, that's the height difference where the lens will land comparing the flat versus the steep meridian, and it's 19 microns. What does that mean to you? Well, when you have 30 microns or greater of difference between the depth of your eye on the flat, the depth of your eye on the steep, when it's, let's say, very toric in the periphery, then the software will automatically choose a toric landing. In this case, because it hasn't met that 30 micron threshold, the eye's relatively symmetric or spherical, it's chosen a non-toric symmetric landing. And then the visible iris diameter measured as 11.4, it automatically is chosen at 10.6. So visible iris diameter minus 0.8 is the starting point in moon lenses. Now this part is maybe the most interesting relative to designing of ortho-k lenses. The software is going to pull from the topography the specific information that it wants to build the lens. Now, normally you and I would need to collect this information, provide it to the art team, and that would take some time. That has the potential for error, but the software really eliminates that time and that error from being introduced. So it's really a convenient way to build the lens. And you can see the parameters are then automatically calculated at the bottom. So the software does all this calculation for you. Let's look at the left eye as well. And you'll notice that the sagittal differential for the left eye is 33 microns. Remember, we said when your difference is 30 or greater, that's when you want a toric landing. That's when you'll create a better, more even, symmetric distribution of the pressure of the lens, helping for centration, helping for effect, helping for comfort. And so here, the software has chosen a toric landing for the left eye. visible iris diameter about the same. We're going to have a slightly larger lens, not that much. And then again, we're going to use this topographical data to build the lens. So the software does all of this work for us, so we don't have to spend time doing the calculations, but we get a highly, highly customized lens from all the information that's uploaded. Now, what the software is doing is it's taking these thousands and thousands of data points. You can see from this map, each one of these whitish lines is an individual data point, and you can start to see the data points as they stretch out to the far periphery. It's using all of this topographical data, not just the Ks, not a 3 millimeter ring and measuring the flat and the steep. It's looking at the radius of the central cornea. It's looking at the toricity of the peripheral cornea. How toric a lens do we need? It's looking at the depth of the eye, the rate of flattening, so we understand the alignment zone. There's so many data points that are being collected that go into the construction of the initial moon lens. So it's pretty crazy the amount of work that's going on behind the scenes that we don't have to do. Now, in the flat meridian, what we're looking for, or along our meridian of greatest elevation, is our lens to land down, in this case on a width the rule cornea at 3 and 9 o'clock. And you see that touch down on the eye surface here. So that would be here at 9 o'clock, and then again here at 3 o'clock. Then you have your edge lift that we would always want in any kind of corneal rigid lens. But then interior of the landing and edge lift is your tear reservoir. And this is what creates our orthokeratology effect. So thin in the center, thick on the outside, creating the hydraulic force that manipulates eye shape. Then along the steep meridian, we want essentially the same thing. We want a lens that lands on the steep axis, or it's very close to the eye surface, maybe with a little bit of tear layer allowing for some movement of the lens when the patient wakes up, starts blinking, freeing up that lens with all those suction forces behind it, but allowing for the centration that we want and creating that reservoir of fluid right here, this deep fluid layer that creates our suction force. So very similar looking pattern on both the flat and steep meridians. Now, you could do this, you could manufacture your own, you could construct, your own very customized ortho-k lens. But what makes this marriage of software and lens together so great is that you have an efficient way of calculating a highly customized lens. So while we teach our contact lens resident every year how to build an ortho-k lens, we want them to understand the construction of all of the specialty lenses. Ultimately, the time involved in doing that is really best done here at a school where you have the time with the resident, you have the time in between patients to be able to calculate those lenses. In a busy practice, you may not have that time. And so being able to use and rely on a platform like this makes life pretty easy. Now, what the software will next do is take those two lenses that you designed, put it into a summary report so that you can send it straight to Art Optical, all done in the cloud, all done online. So you're not sending even an email, it's just done through the cloud. But I want to bring your attention to this box right here. Just before we submit, there's this check, request consultation for this order. And I might ask Bethany to come on with us. And Bethany, why would we use this checkbox? When is it effective to use it? What does the consultation team do with it? Could you give us a little bit of insight on why we should use it, when we should use it?
Yeah, definitely. I think it's honestly a really great option, both for experienced ortho-k fitters, but also, of course, certainly new ortho-k fitters. So for an experienced fitter, they might be new to MOONLENS, but certainly they're new to this platform. So it's nice to just know that you have somebody that's there at the lab that can go ahead and look through and make sure that we've gathered all the correct data and we're not missing anything. So I like it from that aspect. But certainly for a new fitter, the things that we're going to be looking at are going to be the quality of the baseline topography, which you mentioned right off the bat is really important. So we're going to take a look at the baseline topography that is being utilized to design the lenses, just to make sure, are we getting good data to design this lens? We might also look at things like, is this a good candidate? Do we want to have just a conversation about, is this going to be basically a slam dunk, or are we going to maybe need to be a little bit patient if it's a high prescription or maybe it's a high cylinder? So when that box is checked, those are all things that we're automatically going to be looking at, but you can also add notes in there if there's something specific that you, as the fitter, are wondering about, then we can go ahead and take a look at that as well.
It's so nice to rely on the art consultation team, especially in a design like this, where it's a complex lens. It's a reverse geometry lens that we're going to fit in a very unconventional environment during overnight wear. And if this is new to you, then it's nice to have that backup from the experts at the art team. So this is something that's really beneficial to all of us. And once you've clicked submit, then you're going to receive an email. So you know 100% that this was successfully sent. Art Optical is going to receive the same email to remind them that there is an order in the system ready to be processed by the lab. So everything all done, automated in the cloud on the KATTCloud platform. Now, the next step, of course, will be Art Optical is going to take that right or left or OU order, process it and send it to you. And then that's when we really begin the treatment. And this is the point where ultimately we could evaluate the fluorescein. And of course, I recommend doing that. But just keep in mind that the lens is not designed to work in the open eye. It's designed to work while the patient is sleeping. So if the lens looks dispensable, even if it doesn't look perfect, you should send the patient home with it. I mean, unless you have concerns that the lens looks like it's bearing on the central cornea and it's moving laterally, like it just hasn't locked itself down, if it's highly uncomfortable for the patient, these would be reasons to have pause. But otherwise, even if the fluorescein pattern doesn't look perfect, it's best to evaluate the lens post-wear, after those hydraulic forces have worked, after you determine where does the lens settle after that lid force is over top of the lens. So let's get the patient into the lens. Let's see the patient after one night of wear. And during this post-wear exam, we're going to do all the usual stuff. Of course, we're going to have a full eye health exam, a full slit lamp exam. We're going to check visual acuity. It's kind of nice to start with where the patient was uncorrected on the chart. And can you see that line? And then just keep moving up the chart as they can achieve those numbers or those that acuity level. And this is a helpful tool because often after one night, you have not achieved full effect. You may be 70% there, but the patient only knows what should be perfect and what's not perfect. So if you can help them to appreciate that you've just improved by 4 lines of vision, then they understand that the process is taking the time that you said it was going to take, that after one night there'd be improvement, but we probably wouldn't be at 100%. Ultimately, we want to get the patient off for topography. We want to know the eye is healthy, of course. We want to know if the vision is improved, but we really want to get to topography because that's how we learn what's happened during that closed eye environment. An important consideration, and one that I didn't heed when I started working with ortho-k, was that full effect is 7 to 10 days. So if we are using our one night appointment to our post one night of wear exam to make decisions, we could be rushing to conclusions. The Ahmed Alabri and Helen Swarbrick work done many years back in the early days of ortho-k, taught us that we get about 70% in the first night of effect. Then as we go along, the AM to PM vision improves to a point where the patient has a difficult time being able to tell what's post-removal vision and what's end-of-the-day vision because it's so similar. And ultimately, the consistency of the effect is much better with each day. So just don't rush to conclusions, I guess, is the point here. If things look like they're off in the right direction, you know it's going to take a week for this lens to achieve full effect. So let's just keep going and find out what it's ultimately going to achieve. If there's signs that you're concerned we have some heavy staining, if the lens is grossly decentered, the topography tells you that the lens was really poorly centered overnight, then these are reasons to wash the patient out and refit. But if things look like they're moving in the right direction, just continue. Now, these are the topographical responses that follow orthokeratology wear. And I think if I look at the cross-section of all the patients that I've seen over the 20-something years, it's about 80% of the time we have a bullseye. And then 20% of the time we have something else. Bethany, could you give us some perspective on what you see at the consultation desk? If it's not a bullseye, what is it typically? What do you see more of? What do you see less of? Could you give us some indication?
Yeah, definitely. So, and honestly, that's a question that we're asked a lot is, okay, what is happening most often that you need to change? And that's a difficult question because it's really different for every patient. If we saw that constantly lenses were always riding high, we probably would change our algorithm to correct for that. So the key is really that, yes, majority of the time they're going to center pretty well. The rest of the time, we're generally going to get a pretty clear response that we can categorize into one of these four other. The one I would say that is probably the most misleading and that I would be careful of is the central island. So a true central island is pretty uncommon. It's quite difficult, honestly, to steepen the central cornea unintentionally. So there's some things, if you see a central island, I would be worried about maybe baseline topography or even post-treatment topography. Do we maybe have some distorted Myers right in the center that are giving us this false outcome when we do our comparison maps? Maybe some central SPK, that would certainly be something to look for because that will also show up as a false island. But ultimately, if we are getting a central island, we don't have SBK, I'm going to be looking back at that baseline because something might be off that's heading us in literally the opposite direction of what we're trying to achieve with an ortho-k lens. So again, luckily that doesn't happen very often, and we can very clearly say, okay, I've got a smiley face, a lateral decentration, a frowny face, and then that'll help us decide, okay, where do we go from there? Now, that part might not be easy, knowing exactly where you want to go, but that's the beauty of this platform is it's going to show us where to go. So I'll let you take it back from there, Randy.
It's funny, Bethany, that you point out Central Island. In, I think, the first year of doing ortho-k, a patient had come back after one night and had that classic appearance of a central island. And so I thought, okay, it's lens too steep for the eye, lens too far off the surface, I better fit flatter. And I just kept getting central island. And I wasn't getting a real central island. As Bethany had said, you have to be careful. Central islands happen very infrequently, and often they're misleading because of some central corneal staining, just a epithelium slow to respond, and so it circles back. It reminds me of that lesson that I needed to learn, that you have to wait more days. Like if you think things are going in the right direction, keep going because they may prove themselves out. Sometimes you have a mild smiley face and you might be inclined to make a change, but you see the patient a few days later and it's a perfect bullseye, or it's slightly frowny face and they come back and it's a perfect bullseye. So again, don't rush to conclusions if you're new to ortho-k.
Perfect. Yeah.
Now, here's one of the areas that I think is very intimidating to practitioners, but it doesn't necessarily need to be relative to the moon lens. And it's here we have a smiley face. And how would you fix a high riding ortho-k lens? How would you fix a lens that was producing consistent staining? How would you fix a low riding lens? What do you modify in the parameters of an ortho-k lens to achieve the ideal bullseye? And this can be an intimidating thing. But with the KATTCloud platform, it was designed to help you through the process to optimize the parameters. So you don't have to be an expert at, do I change the reverse curve? Do I change the alignment zone? How much do I change the alignment zone? All these questions that might pop up. This is all done by the cloud. So basically, we can just take our outcome, tell the software what happened, and it's going to manipulate those parameters. The Art Optical team can do that as well, but you can do it probably quicker than you could get on a call with a consultant and or send an email. It's that easy to do. So I'll try to walk you through that process. Now, often we'll have under or over corrections. Usually under corrections might pop up as one of that 20% of times that we needed to make a change. And if you had a under correction of -1, all you do is say, I have a bullseye outcome, a perfectly centered outcome, but I want an additional -1 therapy effect, or an additional 1 diopter of treatment. I punch that in and the software will just make the changes necessary. Flatten the base curve, raise the sagittal depth slightly in compensation, and then you'll get the appropriate parameters to create the hydraulic force necessary. If you had a central island, if this was your topographical outcome, you could compare your map to the gallery of findings. So there's a bullseye topography, central island, smiley face, frowny face, and lateral decentration. This certainly looks like central island. So I could click central island moderate. That's the one it appears most like. And then click select central island. It would make the adjustment. If I had this topography where the blue treatment zone is riding high with your paracentral steepening here, you could compare that to the gallery of findings. If in doubt, always choose moderate. That will create the 1 standard deviation of change. That'll create a significant change to the effect. I would say 95% of the time, I'm choosing moderate for most of the changes. Now, these maps are all in axial. If you think in terms of tangential, you can just click on the menus here and change this to a tangential interpretation. If you want to look at it both ways, then you'll see both your map and the gallery of maps change from axial to tangential. So you have a lot of functionality with the software in your analysis. Frowny face, another one of the outcomes that you may see, and that's the opposite of the smiley face, where the blue treatment zone is decentered low and you get your frown, your upside down smile, low in relationship to the pupil. And again, here we would choose mild, moderate, or severe. And in this case, I would choose moderate. I think this looks like a pretty typical frowny face outcome. I want to make a significant step, and that would be the moderate response. So easy to fix the lens because I'm just going to click what looks most like my outcome, and the software will make the appropriate parameter changes to your moon lens. So when you have your topographies, your post-wear topographies, what you're going to do with the KATTCloud platform is simply go back to that Cloud Link button. This is a icon that's going to land on your topographer software once you have a login to the KATTCloud platform. It'll ask you, do you want to download the Cloud Link? You'll say yes, and the Cloud Link will automatically link to your topographer so that when you have maps you want to upload, you just click on those maps, click on the Cloud Link, and it automatically goes to the KATTCloud. So now I've uploaded this outcome to the KATTCloud, and I can go through, does it look like a bullseye? Does it look like central island, smiley face, frowny face? In this case, I've selected bullseye, and it does not look like a bullseye. It's not well centered to the pupil. It's riding low. I want to look for which topographical outcome is most like mine. And in this case, a low riding lens would be a frowny face outcome. So I'm going to click on the frowny face. I think it looks most like a moderate. If I'm not sure, I'm going to click moderate. If I'm a little bit concerned that I need some backup from the art team, then I'll just click on request consultation, and they can make the call on this. So you can do it yourself, or you can have the art team assist. Now, next is we might have a frowny face outcome, a low riding effect, but we might also have an undercorrection. So we can enter in whatever residual RX is present and then click save and calculate the lenses. So it can do numerous things at the same time, not just fix if the lens is decentering, not just fix if you have a under or over correction. Now, you might click the duration of effect. That's a good record for both you and the art team. As an example, if it's only been a one-night response and it's a mild frowny face, the art team might say to you, well, we really should see this patient after a little more effect to prove out that this is indeed going to be a frowny face after a week of wear. So it's really good to have the duration of treatment, because if it's one night, that's completely different than if it's full effect. Similarly, if it's 6 months, it could be other things. It could be the lens starting to warp. There's many things that could happen, and being able to communicate the full picture to the consultants helps them to help you. So the next step is just to click save and recalculate the lens, and then that will allow us to process the order at Art Optical, just clicking a few buttons, and we've now modified the lens parameters so that we can get the correct lenses on eye. So it's a really good system to help you through the entire process without requiring you to be an expert at ortho-k, or without requiring you to be an expert at the MOONLENS. You might be an experienced orthokeratologist, but MOONLENS is slightly new to you, and this is what the software is designed to help with. So ortho-k lenses can be quite complicated, and Bethany might not like me to say that they're complicated lenses, but they are when relative to, say, a corneal GP with base curve, optic zone, peripheral curves, and we consider diameter and power pretty straightforward. But in an ortho-k lens, it's base curve, flatter than the radius of the eye, then reverse curve, then the alignment zone, then the peripheral curves, the toricity, all these things. It's nice to rely on software that can do all the work for you. And as you can imagine, if you're relying on software, you don't have to be the one doing this whole process. Your technician can upload the topographies, can process the order for you. So you don't even have to be involved in the uploading of maps. You don't have to be involved in the calculation of lenses. And really letting the software do the hard stuff makes a whole lot of sense in a lens that we're trying to fit to be micron accurate. So whether you're experienced or not, this is a great tool to make your life more efficient. It must take less than a minute to upload the topographies and complete the order in both eyes. Maybe less than maybe 30 seconds, but it's pretty quick, put it that way. So you're not collecting a bunch of information from the topography to put into an email along with the RX and any other pertinent information to send to the lab to have it ordered. It's just uploaded to the cloud, and the art team has what they need to build the lens. So this platform is really a key piece of software for efficiency in ortho-k by using the topography and pulling all the information automatically from the topography and designing the lens from it just is going to make your life much more efficient. And then with the MOONLENS, it's a customization for the base curve, the depth, the reverse curve depth, the toricity of the lens, the alignment zone shape in both the flat, steep meridians, the edge lift, all of these things chosen by the platform. You're going to get a highly customized lens specific for the patient age, the patient RX, the patient eye shape, and the patient age. Sorry, did I say age? The toricity, basically everything about this eye, you're going to take into account in the construction of the lens. So this platform isn't just a tool for designing the initial lens. It's also a very helpful tool for assisting to optimize when you need to tweak the position of the lens, when you need slightly more effect, when the lens is just touching the central cornea and we need to raise the sagittal depth a slight amount. All of these things can be manipulated by the software without us needing to be experts at each individual zone of the lens and needing to know what needs to be done with it, or even relying on the art consultants. The software platform can really do a lot of the heavy lifting for both us and the art team. So it makes everybody more efficient. Now, is it accurate? And these studies out of Hong Kong Poly looked at using the KATTCloud platform to build a ortho-k lens. And you can see that using, in this case, the Medmont, using the KATTCloud platform, created a 95% first fit success in the 2019 study by Ki Tan, and then by Ella Guo, it was a 97% first fit success. So it's possible to achieve a very high level of success with this software. Now, do I presume that you'll get to 97%? I don't, and the reason for that is that this was a controlled study, so they would choose their candidates very carefully. There'd be a tight range of RX, a tight range of eye shape and astigmatism and such, but can you achieve a high first fit success? Yes, you can. So that's what the strength of this tool is, both its efficiency, but also its accuracy. Now, if you have a linked topographer, that is really the most efficient way to be able to build a MOONLENS and use the KATTCloud platform. So that's a Medmont, an Oculus, a Pentacam, a Keratron, a CSO topographer. The team at CAT is always adding new topographers one at a time. So it may be that your topographer is next, and you can talk to the art team about that. If you don't have a linked topographer, that's okay. You won't have the same level of automation, but you can still calculate a highly customized MOONLENS from the data that your topographer employs. And that would be the way we make most orthokeratology lenses, collecting the data from the map, giving it to Art Optical or keying it into software. The KATTCloud platform for linked topographer users just makes ortho-k about as efficient as it can be. Now, one thing that I think might be apparent from this talk is you have, sorry, phone's ringing in here. You have the ability to have your technician do much of the work. The technician can take the topographies. The technician can upload the maps. They can order the final custom lenses for your patient. So ortho-k can be even more efficient because you can use your technicians rather than you needing to be involved in this entire process. Sorry, I'm using somebody else's office right now, and I don't know how to turn off the phone. So the KATTCloud platform is this very efficient, accurate, and effective tool in orthokeratology. It's the most efficient, accurate, and effective way of building a MOONLENS. So kind of an exciting time with the art team that we have this tool to be able to construct uber customized orthokeratology lenses. And in case it's a question that comes up, what does it cost to use the software? And you will receive the MOONLENS login at no charge. There's no fee to use the KATTCloud platform. It's just part of using the MOONLENS. It's ART wants you to have this so that you can be accurate and efficient with orthokeratology. The art consultant team is really a key component. Our team here at Pacific uses arts consultants very often for many different types of lenses because we don't necessarily understand the nuances of each section of every lens that art might produce. So it's nice to be able to have a backup, somebody like Bethany, who's the most experienced consultant on the team, who's trained the entire art consultation team. And that's helpful to have that backup. When you have a question of, this is slightly smiley face, should I modify this or should we just wait this out? I've got a little bit of grade 1 staining. Should we modify for it or should we wait this out? You know, these kind of ortho-k questions that aren't immediately apparent, that might be helpful to have the backup of the art team. So hopefully this all makes sense. This is, again, webinar 2. Excuse me. The third one is designed more specifically for users that do not have a linked topographer. So if your topographer isn't one of the ones mentioned, then it might be beneficial to log in with us for webinar number 3, and we'll explain how do you collect the information from your topographer and then manually import it or manually enter it into the KATTCloud platform to create the customization. Bethany, did I miss anything, or was there something that I could have better communicated that you could help me out with, or can we go into any questions that may have arisen?
Yeah,
Thoughts?
definitely. No, I thought it was great, Randy. And really, you keyed in on some important points, which is, you know, right from the start, you mentioned getting good baseline topographies, taking the time to start off with good data. I love the part about being patient with your changes and not making changes too quickly. That is something, you know, that we talk about quite often with brand new orthokeratologists because you know, there is a lot of things happening, a lot of moving parts with ortho-k. And when you're brand new, you're a little worried about everything. And if the fluorescein doesn't look perfect, you know, should we dispense it? If I don't have full correction at day 1, do I need to make changes? There's a lot of patience, I think, that needs to happen when we're fitting ortho-k. Wait it out if things are looking pretty good, and you'll have a much better answer, a clearer answer at that 7 to 10 days, where it will be very distinct response that you can then select, you know, within this platform that, yes, it's definitely, you know, a frowny face or a smiley face or whatnot. So all good points. And I think, you know, having this platform is so helpful because there are so many moving parts. So yes, if I want to flatten the base curve to maybe push a little more treatment, then we want to also make up for that by adjusting the RCD. These are things that we're thinking about from a consulting standpoint and may not readily come to mind as a new fitter or even an experienced fitter who might be new to MOONLENS. But what's great is the platform is going to do that thinking for you. You're going to put in that it's a frowny face, that I have a minus 75 residual, and it's going to make those adjustments for you. And then as a bonus, you can, of course, select consultation and have us take a look at it too and make sure there isn't something else you know, that we're missing that we might want to talk about. So you can still always utilize the consultation team.